Good evening, Chris here. I hope you're all keeping well. I wanted to touch base with you tonight to tell you about the webinar that Peter and I attended almost a week ago. Some of you might have seen the post up on our Facebook page about it. The webinar covered a really interesting and important topic, and that topic was research. It was taken by a doctor called James Chestnut. James Chestnut is used by many of the medical journals to assess the quality and validity of research. He only provides evidence-based care when it comes to his treatment of patients, but he is in actual fact a chiropractor. So many of you might be thinking, well, that doesn't really add up as there's no evidence supporting chiropractic treatment. But on the contrary, there's actually been a lot of research done over the years to support the benefit and safety of chiropractic treatment. And James Chestnut brought many of these research papers to our attention. And I'm actually in the process of accumulating a bit of information and writing some notes on those particular research papers. And I thought I'd just talk to you about one in particular tonight and maybe introduce a few others over the next week or two, just to let people know that the research is actually out there. It's easily found on the internet, and I'll talk to you about this research paper here I've got in my hand. So this is a study called the Manga report. It was done in 1993 and it was conducted by the Canadian government. So Professor Manga looked at all of the literature and research over many years, comparing the safety, cost effectiveness and effectiveness of chiropractic treatment and medical management of low back pain, such as drugs, physiotherapy and surgery. So the government of Canada, or the Ontario Ministry of Health, basically wanted to see if what they were doing was the best thing at that time for low back care, low back pain. Now, Manga concluded that all the evidence supports that the report overwhelmingly supported the efficacy, safety, scientific validity and cost effectiveness of chiropractic treatment for low back pain. And he actually recommended to the government that chiropractic should be integrated into the Canadian healthcare system, and that a very good case could be made for them being the gatekeepers for the workers' compensation scheme system in Ontario for management of low back pain. Now, why this wasn't acted on by the government, I won't go into, but this is all, like I said, you can find this on the internet yourself. It's called the Manga Report 1993. Now, I won't talk to you too much more about things at the moment. Like I said, I might just introduce a few other research papers over the next week or two. But the main thing I wanted just to highlight was that chiropractic treatment has in fact been proven in research to be the safest and most effective form of treatment for low back pain in particular, as that's the area that's been researched the most. So don't let anybody tell you otherwise. Thanks.